Hey guys, Dr. Seth Gerlach here. In this video, we talk about mammograms versus thermography and really in regards to diagnosing. So we want to make sure, especially with things like cancer, that we're able to be on the cutting edge without causing harm. So we talk about mammograms, safety and sensitivity. We talk about things like false positives. Then we talk about thermography, how it's different, how it works, and what we're actually picking up with thermography. So I really hope you enjoy this video. If you had any comments, please leave them below. And please consider subscribing if you enjoy the video so you can be one of the first to enjoy our content as it comes out. Hope you enjoy it. Have a great day. Hello everybody, Dr. Seth Gerlach. I'm here with my really good friend today, April Abbonizio. I'll introduce her in just a second. But this broadcast is for anyone who knows someone with cancer, maybe you have cancer, or you're just interested in knowing how to detect and prevent cancer before it becomes a problem. And so we're going to talk today about mammography and thermography, the different pros and cons for each, and kind of talk through some of the science and some of April's experience because she's kind of an expert in this field. So April is the owner at Midwest Thermography Solutions in St. Louis, and she practices thermography. So April, I guess just give us a brief intro, how you got into this, and what's your favorite part of doing this, and then we can get into the nitty-gritty.
Okay. Well, I learned about thermography when I was at the age where I needed a mammogram, or they were telling me that they wanted me to get a mammogram. And so I was looking for alternatives, and I came across thermography and did a lot of research on it. I wanted to make sure it was credible, it was effective, and I kind of fell in love with it, and not only for the breast screening, but full body screening. And so I ended up incorporating it into my health coaching practice, and now it's all I do.
That's awesome.
Yeah,
and we'll get into more about thermography later. Just because I love the modality of it. I think it's really cool. I think it does a lot more than just cancer detection type stuff. I think it's what it's most known for, right?
Right.
Cool. So we'll get into all that today. I first want to talk about mammograms. And so, most women, they're getting a mammogram every year, every other year, if they're in their 40s and 50s usually. So the whole idea is we want to find cancers before they become too big in a problem and then deal with them somehow to try to mitigate the risks and the dangers, right? So when I look at any kind of treatment or modality or testing technique, I want to make sure it's one, it's effective, it's doing what it's supposed to do, and two, it's safe. So let's talk about maybe some of that from what you've seen, and I've got some facts and figures and stuff here too, but the biggest thing I see, so as far as it being effective, can we actually find what we're looking for, which is, changes in tissue and even like cancerous and precancerous cells before they start multiplying, because cancer cells divide very quickly, right? So
yeah, they do every 90 days. They double every 90 days. And they grow faster in younger women. And as we age, they grow slower.
Gotcha. So I guess that's why it's so critical to catch it early,
right?
Before you've had years and years, and some people decades of this going on. So when we talk about effective, like how many cancers are we able to find, and are all those all really true? So there's this big study I found that this was 60,000 women, and they looked at the areas of concern. So mammograms, testing, the areas of concern. And what they found were in 70% of the areas that mammography was flagging, 70% of those were false positives. Right. So we're getting overdiagnosis of women, and women are going through treatments that maybe they don't need, all for the potential to track down these cancerous cells. But let's back up for a minute and maybe see, can you explain to everyone what mammography does and what exactly they're looking for?
So mammography is more of an anatomical test. It's looking for anatomy, the actual lump and tumor, which takes a long time to form. to be big enough to be seen in a mammogram. So they're actually looking for something that's already there, as opposed to thermography, who's watching for early changes, and you can actually watch it forming.
Wow. And what I've seen, correct me if I'm wrong, but we talked about how these cancer cells divide and spread, and but from what I've seen, for it to be visible or detectable by a mammogram, a lot of these tumors have been already growing for 5, 8, maybe even 10 years.
Right.
Is that what
They're
you've
just,
seen?
yeah, they're just now big enough to be seen. It takes a long time, when a cell is so microscopic that it'll double. So in 90 days, there'll be 2 cells, and then in 180 days, there'll be 4 cells. So it just takes a long time for it to build up. And, when you're looking structurally, it has to be big enough to be seen. And a lot of, these false positives that you're talking about is dense tissue and fibrocystic tissue that looks so much, it looks just like cancer. It's just a whiteness in the x-ray.
Yeah. And I saw there was a Canadian study, and they were talking about that, how the density of tissue really, really matters. And so the sensitivity ranged from like 98% down to 48%, depending on how dense the breast tissue was. So when you're down at 48%, you're flipping a coin.
Yeah,
essentially.
That's true. And I think the average in a lot of those studies comes out to be about 80% sensitivity for mammography.
Gotcha.
Thermography is up to 90%.
Gotcha.
Sensitive. It catches 90% of cancers.
Wow.
So, yeah, it's crazy. All the false positives. There was a study in Denmark that was done, and 48% overdiagnoses in women.
Wow. It's a multi-billion-dollar industry, and you'd hate to think that we'd be doing this on purpose, but you have to take a step back and think, like, every once in a while, is what we're doing like really the correct thing kind of going forward here? And I've got something here also from the Cochrane database, Systematic Review, 2009. They're again talking about the overdiagnosis of all these screens. And they essentially summed it up. They said, for every 2,000 women who were screened every year for 10 years, 1 woman would have her life prolonged, and 10 healthy women who had not been diagnosed, they were treated unnecessarily.
Yeah.
So that window there for helping out people seems very small, but it seems to have more of a downside as far as overdiagnosis.
Mm-hmm. Yeah, absolutely. The New England Journal of Medicine had a study that claimed over a 30-year period, 1.3 million women have been overdiagnosed and overtreated.
Wow.
Unnecessary mastectomies, unnecessary chemotherapy, unnecessary radiation.
That's crazy. So then we start to get into, I think, kind of the safety aspect of all this too. So we talk about, and we'll get into thermography too, but how we talk about effectiveness. So we may not be as specific, and we may have some overdiagnosis, but then is it safe? Are the things we're doing safe? So mammography, in essence, it's radiation, right? We're radiating the tissues, looking inside to look for changes. So
it's ionized radiation. So
right.
It accumulates in our body, and people don't realize that. That it's accumulative. We can't detox radiation out of our body.
And so the International Agency for Research on Cancer, the IARC, they classify different things in foods and toxins, whatever, to be carcinogenic, possibly carcinogenic, probable carcinogenic, and ionizing radiation is a class 1 carcinogenic, which means it's carcinogenic to humans. And so you have to kind of shake your head and wonder. So we're trying to detect cancers, so the cancers aren't being more widespread and killing more people, but in return, we're radiating people every year, which causes cancer.
Yeah, it increases your risk for cancer for sure.
Yes.
It's I read a statistic one time that said that there is 1,000 times more radiation in a mammogram than there is in a chest x-ray.
It's
It's a
insane.
lot. And then they pull out these 3D mammograms, which are supposed to be so great, but they're even 30% more radiation.
Wow.
Kind of scary.
And then, well, the thing of it too is women are going every year or
Hmm.
every couple years, but then in the case of, hey, we find something, we're going in even more frequently sometimes.
Yeah.
So again, like you said, it's really hard to get out of our body once we've introduced it. It's not like, oh, it just goes away. I can't see it. It doesn't hurt me. So these are the things we need to kind of think about as we go through this. And another thing of the, not just the radiation, which is a very big aspect, but how the breast tissues are compressed during the actual study.
Right.
What did you
It's
see with
almost
that?
50 pounds of pressure,
Yeah,
which, I mean, common sense tells me that putting 50 pounds of pressure in any part of your body is not good. You know,
right.
you're harming your cells, whether they're healthy or whether they're sick. And if you have, you know, an encapsulated tumor in there, you're chancing a rupture of that. And if it ruptures, it's not contained anymore, which means that it spreads throughout your body. So it's not contained in that one area.
Yeah, that's very, and I think I saw that maybe up to like even 20 pounds of pressure was enough to rupture some of these
Mm-hmm.
encapsulated tumors. And if we're going to 2.5 times that, then holy moly, you know, it's a recipe for disaster if we're doing this to every single female between 40 and 55, you know, every year.
Right.
So,
Especially if you have dense breasts, which makes
yeah,
it more difficult.
oh my gosh. So, really, from what the science shows, I mean, the effectiveness, the sensitivity is not as great as we would like it, and there's even overdiagnosis. And the safety of it is we're introducing some of these things to the body that can not only be detrimental, but have been shown to potentially cause cancer. The
Right.
stuff we're trying to, you know, detect in the first place. And it really, I think, comes down to not just detection, but prevention. But I mean, we want to, of course, prevent cancers. That's a talk for another day. But today we're really talking about detection. So let's get into then thermography more. So mammography looks at structure. So let's go through what thermography kind of looks at and how it's different.
Yeah, so while mammography looks at the structure, the anatomy, thermography is more physiological and functional. So it's looking at the blood flow or your thermal patterns that should remain pretty constant our whole life unless something is going on. So we're thermally symmetrical pretty much from right to left. And so based on different patterns, asymmetries, it tells the doctors, you know, if there's something going on. And they're looking for changes over time because we should remain constant. If they see changes, they know something's going on.
Gotcha. And so from what I've seen from thermography too, these cells and these thermal patterns change usually way before we start to see growths, tumors, changes that we can see anatomically, right?
Yes. So, you know, it starts with one cell that doubles every 90 days. We talked about that. So, you know, at a certain point when it's about 256-ish cells, about 2 years into the process, you can start to see changes thermally. And what happens is that blood, you know, if you have cancer cells in there and they're doubling, it needs a blood supply, it needs a food supply, a nutrient supply. So the blood vessels form, they open, they form more vessels, and you have more of a blood supply there. And that's what changes the thermal patterns
Wow.
in the
Uh,
breast. Mm-hmm.
so are you seeing, I guess, more women start to reach out for thermography in place of or in addition to mammography?
For sure. I've been doing it for about 5 years, and I definitely, there's, you know, we try to educate all the thermographers out there, try to educate and let people know the option. And, but I definitely am seeing more knowledge about it and more people wanting a safer option.
Yeah, that's great. And I think it's what it is. It's a safer option that can even be, you know, detect changes in the body before they become problems. And we talk about, I know it's not just breast cancers and things like this, but it's whole body. So I know you do full body scans and all kinds of stuff. So have you seen any like crazy stories or anything come in like, oh my gosh, we found this on thermography?
Well, I don't know if I say crazy, but I've had a handful of breast cancers that you can't diagnose breast cancer without a biopsy. You have to biopsy. It's the only true way to know if it's a cancer. And I have one patient that comes to mind, and she was told that she had a 90% chance that she had DCIS cancer, and which is basically not cancer. Kind of, it's stage 0 cancer.
Yeah.
But the diagnosis for that is it's like gone up 300% in the past like 10 years. It's kind of crazy. And so she chose not to have a biopsy, but we scan her every 6 months and nothing is changing.
Wow.
So she may have DCIS, we don't know for sure, but if she does, it's encapsulated and it's not growing. There's no blood supply that is active in there. So she's choosing not to do anything about it, which I think is a pretty smart move.
Gotcha.
I've seen women that have active cancer that come in every 3 months. We're watching the tumor to see if their treatment is helping or if it's not helping. And luckily we've seen good progress in the ones that I have. But I had a woman who had been stable with breast cancer. Nothing was happening for a long time, and then last time she came in, there was activity. So, but it's, you can catch it so many years earlier, the cells that are starting to multiply, that you can actually, if you catch it early enough with diet and lifestyle, reverse the direction that it's going into.
Yep.
So, if you're very consistent with your thermograms after you've had a stable baseline, then, you're catching things really early and your prognosis is better. You could reverse it potentially, and your treatment, it's much less invasive.
Yeah, that's the key thing. So detecting and then making changes to mitigate or reverse or whatever we need to do. And I know, hi, Stacy, by the way, Stacy says hi. In other instances, when people get like a half or full body thermography, and we see changes in thyroid vascularization or the gut or liver, and you can actually pick up and see different parts of the body that could be potentially pathologies or things in the body that are imbalanced.
Right.
How often do you see things like that?
All the time.
Okay.
All the time. I mean, sometimes they know about the issue and sometimes they don't. I had a patient come in who's very healthy. She does thermography preventively, trying to make sure everything is in balance. And her thyroid came back as, the patterns were a little hyperthermic. And so she went and had blood work done, and the blood work was normal. And so she went and had an ultrasound done, which is beyond what most people would do at that point. But she was very curious, and sure enough, she had a nodule on her thyroid.
Wow.
And so they're going to watch it, and she would never have known that, had she not done thermography. Yeah. But, lots of things can show up in a thermogram, dysfunction in your colon, in your kidney, digestive issues, major hormone imbalances, vascular issues, heart and lung. I mean, so many things. And it's non-specific. Most of the time, it'll tell you where there's trouble areas. But since, the commonality of all these degenerative diseases is inflammation, that's what it's showing is inflammation. And so there's an increased blood supply. So it changes those thermal patterns.
That's awesome. So it's really functionality we're looking at instead of anatomy.
Right, correct.
How the body and how the body's organs are functioning, and the cells really, and seeing changes. That's awesome. So what does a typical process look like if someone wants to get thermography? What happens during the whole thermography process? Because I know it's a little different than a mammogram.
Yeah, so the first thing we do is go over a health history. The doctors who interpret these images take, your history, your concerns, your symptoms all into account. your family history even, when they're looking at, the images. And for breast imaging, all of that contributes to your risk level. They assess your risk for breast cancer, which is nice. You're at low risk, you're within normal limits, low risk, moderate risk, high risk, or you have a confirmed malignancy. So, so they come in and we do the health history, and then we take a series of images. So depending on if you have one region, or if we do, which is typically the breast, which is 5 images, we'll do a front view, 2 lateral views or 2 side views, and then 2 oblique views. If we do upper body, it's 16 images from head to pelvis. And if we do full body, it's 28 images of the entire body.
And you use a specific kind of camera, right?
Yeah, it's an infrared camera. So what it does is it's a specialized camera that picks up the infrared radiation that is coming off of our skin and turns it into a very colorful picture. And the colors represent temperatures. And it's very specific. I mean, they read down to the pixel, and there's like 19,000 pixels per picture, and each pixel is read to the 100th of a degree. So it's very, very specific when they read. So they're looking for different patterns. They just, people see heat or red on their image and freak out. And you have to tell them there's going to be that range of color on every single picture. The doctors look for patterns. They look for temperature differentials. It's not just a red spot.
Gotcha. So then the reports are sent off. The doctors read them, right?
Mm-hmm. They're MDs, board certified in thermology, and they read them, write up a report, and then that report will come back to me, and I will send it out to the patient, and then send it out to their doctors if they want me to.
Gotcha. And so all of this is completely non-radiation, right?
No radiation. It's no compression. It's non-invasive. It's 100% safe. It's safe as taking a picture with your iPhone. I mean, it's very, very safe.
Yeah, and that's what I love about it. So we go back to safety, and is it effective? And I think it's both of those. And there's not a lot of other therapies you can say that about when you look at risk versus benefits.
Yeah. There are cancers that you can't see on a mammogram. There are cancers that are thermographically silent. I mean, that's why, even if you just do thermography and you don't want to do mammography, which is what I do, I just do thermography, but I also every once in a while will choose to get an ultrasound to get that anatomical test a safe way. So you have that backup because, like inflammatory breast cancer can't be seen on a mammogram, but it's very well seen on a thermogram. But there are cancers that are thermographically silent, about 10%, and they're rare, but they're there. And so, you don't want to solely use one or the other. They work well together. I use mostly thermography, and then every once in a while we'll have an ultrasound.
I think that's an amazing point because there's no one size fits all,
right.
Like you said. But I think that's great that people have options and they know. I think knowledge is the biggest thing because most people, they don't know that these other modalities are out there. They don't know that they don't have to get a mammogram every year. They have these other options at hand. Same thing with dietary stuff. Same thing with, natural physicians. I feel like, a lot of people don't know, oh my gosh, there's other doctors that look at things differently than my doctors do. So it's a great time to be alive right now in the natural health field, I feel like, because there's so many things up and coming. It's a really, really great time.
Yeah, I agree.
Anything else you want to add before we kind of wrap up here on thermography, mammography, cancer, anything at all?
No, I guess the only other point that I would have is what I like about thermography versus mammography is the fact that you're not just looking at the breast, what can be imaged in the x-ray, but it actually gets, half your neck, your armpit area, which the upper outer quadrant is where most cancers are found, and actually up there towards your armpit. So a lot of times it's not even captured in the
Great.
image of a mammogram. So it's just kind of nice. You see everything that feeds into the breast and that feeds out of the breast. And so I guess I like the coverage of thermography as well.
Great point. I love it. So we're thinking holistically now. That's awesome. So where can people find more info on you and thermography?
So my website is long. It's midwestthermography.solutions.com. There's a lot of information on there, and I'm also on Facebook. But there's a contact me section, and if they want more information, if they want to call me, all that information is on the website.
That's awesome. And I'll link some of those below so it's easily clickable for people also. I do urge you guys, if you're interested, just reach out, ask some questions, do some research, and just see if it's right for you. April's a really good friend of mine. I send a lot of people her way, and we work together on a lot of cases, and I really feel like this is cutting edge stuff, and it really does help people moving forward. So check it out, read up, ask questions, and kind of go from there. April, thank you so much for coming on today. That was some really great stuff you shared. And I love what you're doing with the thermography. So keep it up.
Thank you. Thank you.
Yeah. Hope everyone has a great rest of your day. Take care.